For this next video, I'm going to show you how to correct a iliosacral upslip, also known as a hip bone shear. Okay, but I call it an upslip. So let's say the patient has had trauma, maybe not in the last week or two, it might have happened many years ago. But they might have said that I fall off something and I felt my pelvis was shunted. So when a patient sits on a hard surface, they don't feel, this is called the ischial tuberosity here, they don't feel level. They feel like they lean to one side, so they feel asymmetrical on the left and right side. So if it's been shunted up, everything on that side will be higher. So the iliac crest is high, PSI is high, ASI is high, ischial tuberosity is high, and the leg will appear shorter on that side. So if I come on to my patient, for instance, excuse my hands here, so you can find the ischial tuberosity and find the levels. Let's say the right side is up, PSIS, one side is higher, iliac crest is higher. Look at the malleolus and it appears shorter, then it might well be that we've got an upslip on that side. So when we correct it, I'll show you two ways. One way looks a bit strange if I'm honest, but it works very well. Come down the couch please, so your knees are hanging off the edge. So this is the prone, So this is the prone leg thrust technique. So you literally straddle the leg on the side that's gone up. We internally rotate because it locks the ligaments within the hip joint, the iliofemoral ligament in particular. So we focus on internal rotation. So when we pull the leg, it doesn't pull the hip joint, it pulls more from the SI joint. If you want to, you can palpate the PSIS in here. This hand stabilizes the opposite leg. So what I'm tending to do is I come onto my toes and my knees are bent. So the technique is very simple because that's all I'm doing is straightening my leg. So when I'm straightening my leg, the pelvis on that right side is coming down because I use the hand on the left side to stabilize. So this is the technique I'm doing. I'm literally just pulling him down this way. Palpate the PSI so you can feel the actual motion of it. And the technique is quite simply, we just literally traction and pull. So this is more mobilizing. So I'm literally just encouraging the whole pelvis to come down on that side. But what we can do, we can ask a patient to pull the leg up, please, Bob. So he is hitching using the QL on that side for 10 seconds. After the 10 seconds where we have this relaxation period, take a small breath in, please. And as I'm palpating, I pull, I can literally, and then from there, it's a quick lock with my legs and I'm doing this movement. Okay, so I'm straightening my legs quite quickly, like this. So it pulls down. So that would be a manipulative maneuver, which is called a high velocity thrust or an HVT. Now, if you don't like the position of this one, the alternative is if you come up onto the couch, please. If you go further up and turn onto your back, please, Bob. So if you just turn over now. From there. Now, from this position, let's say we want to work on this leg. We bend the opposite leg so we don't affect this side of the pelvis. So when we're doing this one, so the technique is very similar, relax your leg. So I would internally rotate the leg to lock the hip. One hand on the dorsal foot, one hand behind, and I'm mobilizing, I'm tractioning from here. Okay, so this is like a mobilization for the iliosacral joint. Take a small breath. And as you breathe out, I can traction, 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 and do a little quick pull from there. Okay, so I can lock, I can see the couch moving with me. Okay, so from there I can literally lock and thrust. If I have a leg externally rotated, this is actually okay because you can mobilize the hip joint. So that's more hip and lower back and pelvis. If I turn the leg in, it's more pelvis, and you can also get a little bit of lumbar spine. So if you've got, say, a facet of L5, that's a bit irritated, you can use that technique. And even if you've got like a bit of sciatic pain, this works quite well because it's not just to correct the upslip, it can also assist in decompressing, if you like, the L5 S1 facet, where it can encourage opening and cause a bit of traction to the lower disc. So it's not just for a correction of A, it can also affect for lower back pain as well. So then that's how I would correct two methods for an iliosacral upslip. And thank you.